Hello, I'm Dr. Edward Langley. There's a particular symptom I'm always mindful of at the hospital, and it's one that's easily overlooked. It's the kind of symptom that can point to something much deeper than a simple problem with your skin. As an oncologist who has been practicing for over 5 decades, I've had the privilege of seeing many patients. And in that time, I've come to understand a simple truth. Sometimes, an itch can be your body's earliest warning that something is wrong. Now, I want you to think for a moment. Have you had a spot on your body that has been persistently itchy lately? Perhaps you've tried all the usual remedies, like moisturizing lotions or special ointments, but nothing at all seems to bring you any relief. It's very common for people to dismiss this, thinking, oh, it's just a part of getting older. Please, don't let yourself fall into that way of thinking. I still see patients every Tuesday and Thursday at my clinic. It might seem a bit unusual, a doctor my age still working on the front lines, but I truly believe it's what keeps me going. One of the biggest reasons I can remain so active and healthy is that I have learned not to ignore the subtle signs our bodies give us. Today, I want to talk with you about something I feel is incredibly important. I want to share the potentially serious truth that can sometimes be hiding behind a simple itch. Last winter, a gentleman named Mr. Peterson, who was 75, came into my office because of a nagging itch on his lower leg. He explained to me that it would only become itchy right after he took a shower. Then, it started waking him up every night, usually around 3 in the morning. He told me that lotions and creams provided no relief whatsoever. Initially, I considered that it might be a common skin condition for his age, or perhaps a form of eczema. But there was something in the way Mr. Peterson described it that stayed with me. He said, "Doc, there's nothing wrong with the skin itself. I can't see a rash or anything. Why is it so incredibly itchy?" It just didn't feel like a typical skin problem. On a hunch, I advised him to undergo some further testing. The results that came back were quite a shock. It was an early stage of lymphoma. I will never forget what Mr. Peterson said to me afterward. He looked at me and said, "I just thought it was because I was getting old." That was a profound moment for me. It made me wonder how many of these signals might have been overlooked throughout the years. Since that day, I've encountered several similar situations. There was a 68-year-old man who had a persistent itch right between his shoulder blades, which turned out to be pancreatic cancer. Another gentleman, who was 73, had a constantly itchy scalp that was ultimately linked to a pre-leukemia condition. From that point forward, I've never treated a persistent itch lightly. That night, I decided to review my 50 years of patient files, and what I found was truly startling. I discovered a statistic showing that about 30% of my patients diagnosed with cancer had reported some kind of localized itching in the 6 months before their diagnosis was confirmed. This was clearly more than just a coincidence. I began to dive into the research, spending my evenings looking through medical journals and speaking with my colleagues about it. Through this process, I was able to identify 6 specific areas of the body where an itch could be a significant red flag for cancer, particularly for those of us over the age of 60. It is very important that you listen carefully to what I'm about to share. The information you are about to hear could quite possibly save your life. If you find this conversation helpful, I hope you'll consider sharing it with others, so that more people can have access to this vital information. Today, I'm going to walk you through 2 very important things. First, we will discuss the 6 areas of the body where cancer-related itching can appear. Then, I'll explain some simple self-checks that you can perform right at home. If you are experiencing any unexplained itching right now, I encourage you to stay with me until the end. First, let's discuss the lower leg. I'm referring specifically to the front part of your lower leg, the shin area. If you find yourself with a constant itch right there, it's important to have it checked for lymphoma. When your lymphatic system becomes inflamed, it releases substances that can stimulate the nerves near the surface of your skin. This is what brings about that itching sensation in your lower legs. This feels quite different from a typical skin-related itch. I want to tell you more about Mr. Peterson, the 75-year-old man I met last winter. For 3 long months, he was suffering from this itching on his lower legs. It began as just an occasional nuisance, but it slowly grew more and more serious. Every single morning at 3 o'clock, the front of his lower legs would begin to itch so intensely that he could no longer sleep. He also mentioned that scratching it didn't seem to help at all. In fact, it often made the sensation worse. He found the whole situation very strange. At first, He thought it might be caused by poor blood circulation. He tried everything from massages and warm compresses to wearing compression socks. His wife was very concerned and even bought him expensive lotions to try, but absolutely nothing worked. Here is a simple way you can check for this yourself at home. For 1 week, try applying a good moisturizing lotion or an anti-itch cream to the area 2 or 3 times a day. For most common skin problems, this type of treatment will usually bring some relief. However, an itch that is caused by lymphoma will not improve with these topical treatments. In many cases, it actually becomes worse. Another very important sign to look for is the timing of the itch. In the early stages of lymphoma, the itching tends to become more severe at night. During the day, it might seem perfectly fine, but it intensifies when you lie down to rest. This is because the activity in your lymphatic system tends to increase at night, and when you lie down, its circulation also slows. It's crucial to understand that itching from lymphoma cannot be fixed with creams or antihistamine pills. This is because it's not a skin problem, but an issue stemming from your internal immune system. If the itch in your lower legs continues for more than 3 weeks without any improvement from creams, you should see a blood oncologist to be properly evaluated. Fortunately for Mr. Peterson, his condition was discovered very early. He received the right treatment and is now completely healthy. With an early discovery, the success rate for treating lymphoma is as high as 90%. So, have you been experiencing any strange itching sensations around your lower leg lately? Next, let's talk about the middle of your back. Your pancreas is connected to nerves in your back, and when there's a problem with the pancreas, it can send a signal through those nerves. In the early stages of pancreatic cancer, bile can flow backward, and the connecting nerve pathways can cause a persistent itch deep in your back. This phenomenon is known as transferred pain, where the source of the problem is in a different place than where the symptom appears. Not too long ago, a patient named Mrs. Clark came to my clinic. This 68-year-old woman felt like she had tried absolutely everything. She had a constant, nagging itch at one specific point in the middle of her back. She first suspected it might be an issue with her bedding, so she went out and replaced her mattress, but the itchiness continued. This time, she replaced all of her pillows and blankets and even did a complete house cleaning to remove any dust mites. She said to me, "Doctor, we have turned our house completely upside down. We threw away all the rugs and even replaced our couches, but I still have this one spot that just won't stop itching." She had even gotten an allergy test from a dermatologist and was given several types of creams to apply, but it was all for nothing. Mrs. Clark also experienced a very specific pattern with her itchiness. The sensation was manageable all day, but it would start to flare up right after she ate dinner. At first, she thought she must have eaten something that disagreed with her, but it didn't matter what she ate. The itching always began around the same time each evening. Here is how you can check for this yourself at home. Using your finger, gently press on the itchy spot in the middle of your back. If the itchiness is related to your pancreas, you will likely feel a sense of heaviness or a deep discomfort. You'll notice that the feeling is different from that of a normal skin itch. Also, pay close attention to your digestion. The pancreas is a vital organ that produces digestive enzymes. If the itchiness in your back is accompanied by poor digestion, especially after you eat greasy or fatty foods, you need to be particularly careful. The key thing to remember here is that a problem with the pancreas can easily send a signal to your back. Many people assume it's just a normal muscle ache or a pulled muscle. They might apply pain patches or feel a little better after a massage, but the underlying itchiness will remain. If your skin looks perfectly fine, but one particular spot on your back is constantly itching, please do not just shrug it off. You need to get a proper checkup. Have you experienced any strange sensations on your back recently? Next, let's talk about the scalp. An itchy scalp can sometimes be a sign of leukemia. The symptoms are quite unique. When your body overproduces white blood cells, inflammatory substances can stimulate the tiny nerves in your scalp, and this is what causes the itching. This is especially true for the areas behind your ears and on your neck. A patient of mine, Mr. Bennett, stands out most in my mind. He's 73 years old and a very detail-oriented person. He had recorded everything meticulously. He said, "Doctor, I've been keeping a journal for the last 3 months, and I've recorded exactly when I feel itchy and when it seems to get worse." He first thought that his shampoo was the problem, so he switched to a brand with very mild ingredients. When that didn't work, He stopped using conditioner and tried washing his hair with just a simple bar of soap. He even tried washing his hair every other day, but none of it made a difference. What was strange was that he didn't have any dandruff or redness on his scalp, but he constantly felt the urge to scratch, especially behind his ears. What's even more peculiar is that he didn't feel the itch at all during the daytime. It only got worse when he would lie down at night. Here is a simple way you can check this at home. Gently feel your scalp. If you have an itch related to leukemia, the specific spot might feel a little warmer to the touch than the surrounding areas. This is due to a very subtle inflammatory response. Also, pay attention to the pattern of the itchiness. An itch on the scalp that is related to leukemia is often worse at night. Just like Mr. Bennett, it might be gone during the day but start up as soon as you lie down. This is because your blood circulation patterns change when you're lying flat, allowing those inflammatory substances to spread out. It's also important to pay attention to any other symptoms that might be happening along with the itchiness. If you've been feeling unusually tired lately, or if you notice that small cuts are not healing as quickly as they used to, or if you're bruising easily or have bleeding gums, you need to be cautious. Have you felt a strange itchiness around your scalp or neck recently? Next, let's discuss the area near the chest. Itchiness in this area can sometimes be related to inflammatory breast cancer or male breast cancer. When a lymph node in the area becomes blocked, cancer cells can cause irritation, and the skin can start to take on the appearance of an orange peel. This is frequently accompanied by itchiness. However, unlike other forms of breast cancer, there may not always be a noticeable lump, so you need to be very careful. I want to share the story of Mrs. Gable, who came in for a checkup a few months ago. She's 69 years old and very observant. She said, "Doctor, the spot right where my bra strap sits has been very itchy, so I assumed the problem was with my bra." Mrs. Gable tried bras made of cotton, silk, and even bamboo materials. She even tried going without a bra and wearing very loose clothing, but the itchiness would not go away. What was strange was that it was only on her right breast. There was nothing at all on the left side. Here is how you can check for this. Stand in front of a mirror and take a close look at both of your breasts. If you notice that the texture of the skin on one breast is different, or if one side seems a bit swollen, or if there's any difference in color, you need to be careful. Mrs. Gable also had some redness on her right breast. The spot where the itchiness begins is also important. Inflammatory breast cancer often starts around the nipple or just beneath the breast. In particular, pay close attention if the itch is only on one side. The sensation usually starts as a simple itch, but over time, the skin may get thicker or start to look like an orange peel. When you press on it, the skin may have lost its normal elasticity. This is also true for men. Male breast cancer accounts for about 1% of all breast cancers. While it is rare, it does happen. If men over the age of 60 feel a persistent itchiness around their nipples, they need to get it checked. It's very important to note that if you can't feel any lumps, but the skin itself is deformed and itchy, you need to be evaluated. Inflammatory breast cancer can spread more quickly than other types, but it is still highly treatable with early discovery. Does anyone here have a persistent itchiness around their chest? Next, let's talk about the area around the anus or reproductive organs. A persistent itch in these areas could be an indication of anal cancer or vulvar cancer. As a tumor grows, it can compress the surrounding tissues. This causes the nerves to become stimulated, which leads to a stinging or itching sensation. This is different from the feeling of simple inflammation or hemorrhoids. I want to tell you about Mr. O'Malley, who is 76 years old. He has dealt with hemorrhoids for the past 30 years. When he first started feeling an itchiness around his anus, he naturally assumed it was just another flare-up. He told me, "Doctor, I've had hemorrhoids since I was a young man, so I'm very familiar with the symptoms. But this time, it just feels different. Usually, my hemorrhoids hurt when I'm sitting or using the restroom, but this time, it just itches, even when I'm perfectly still." So, he tried applying more hemorrhoid cream and took warm baths 3 times a day. He even went to the hospital and had hemorrhoid surgery, but he was told that everything looked fine. Here is how you can check for this. Take note of the specific area of the itch. Hemorrhoids or normal inflammation will generally cause discomfort over a wider area, but a cancerous itch is often concentrated in one specific spot. Many people describe it as a feeling of being pricked by tiny needles. The intensity and pattern of the itchiness are also different. With normal inflammation, the itching usually gets better over time with treatment. A cancerous itch, however, tends to worsen over time, and it's especially bad at night. Mr. O'Malley said that his itching was always most severe when he laid down at night, making it very difficult to sleep. Also, pay very close attention to any other symptoms that come along with it. Watch for any bleeding during your bowel movements or any changes in the consistency of your stool. If you feel any discomfort when you urinate, or if the color and smell of any discharge changes, you need to be careful. Also, check how the area responds to treatment. Normal inflammation can often be relieved with appropriate creams or warm sitz baths. In cancerous situations, these treatments will not work at all. In fact, the condition often gets worse over time. It is so important that you never delay a checkup because you feel embarrassed. It is crucial to get checked early. Just like Mr. O'Malley, there are many people who ignore these symptoms because they have a pre-existing condition. Is there anyone here who feels a persistent discomfort in this area? Lastly, let's talk about the hands and feet. If you find that only the palms of your hands and the soles of your feet feel itchy, you need to check for internal cancers. Toxins that are produced by cancer cells can travel through your blood and affect the peripheral nerves. This can cause the tips of your fingers and toes to start itching. This symptom usually only comes about when the cancer has reached a certain stage, so you need to be very careful. One person who really surprised me was Mr. Sullivan, who is 70 years old. Only the palms of his hands were itchy. He first thought it was a form of eczema, often called housewife's eczema, and he received treatment from a dermatologist for it. He said, "Doctor, I wear gloves now when I wash the dishes, and I even switched to a very mild soap. Why is it still like this?" Mr. Sullivan managed it very well, applying lotion 5 or 6 times a day. He even started wearing cotton gloves to bed at night. He thought that perhaps he was washing his hands too often, so he cut back to washing them only once or twice a day and only used lukewarm water. Strangely, the backs of his hands were perfectly fine, only his palms were itchy. He said the lines in his palms were especially itchy. Here's a simple way you can check this at home. Take a close look at the soles of your feet and the palms of your hands. With itchiness that is related to cancer, the skin color may take on a yellowish hue, and the lines in your palms and soles might look deeper than they did before. In Mr. Sullivan's case, the palms of his hands were indeed slightly yellowish. The pattern of the itchiness is also unique. Usually, both the hands and the feet will be itchy. It's also typically worse at night and better during the day. Also, the way you can relieve the itch is different. With normal skin problems, moisturizing or soaking your hands and feet in cool water will often help. But these methods do not work for cancer-related issues. They may provide a temporary cooling sensation, but they will not solve the fundamental problem. It is important to understand that people frequently mistake the itchiness of the hands and feet for a simple skin problem, diabetes, or poor blood circulation. A lot of people just let it go because they assume it is a part of getting older. However, if only the palms of your hands and the soles of your feet feel itchy, you need to be mindful of abnormal peripheral nerve function or a systemic disease. If you are over 60 and you experience this kind of itchiness for more than 3 weeks, you need to get a complete checkup. Have you felt any strange sensations in your hands and feet lately? Now, I'll tell you how to check on yourself with 5 simple diagnostic steps. You will be able to catch things early if you just remember these 5 things. First is the 3-week test. If any itchiness lasts for more than 3 weeks, it is likely not a simple issue. Normal skin problems or allergies will usually start to get better within 1 or 2 weeks. Mark it on a calendar, and if it goes over the 3-week mark, you need to go to the hospital. Second is the lotion response test. Use a moisturizing lotion or an anti-itch cream for 1 week, applying it 2 or 3 times a day. The itchiness should get better if it is just a skin problem. But if it doesn't work, or if it seems to get worse, you need to suspect an internal issue. If external treatments are not working, then it's probably not an issue with your skin. Third, check for side symptoms. Itchiness from a serious condition often doesn't come alone. If you have unintentionally lost weight, say 5 to 10 pounds in a single month, or if you are much more tired than usual, or if you have a persistent low-grade fever, you need to be checked for internal problems. You should get a checkup sooner if you have any of these symptoms along with the itchiness. Fourth is the itch pattern analysis. It is very helpful to record when the itchiness gets worse. A cancerous itch often intensifies at night and is better during the day. Also, watch out for one specific spot that itches constantly. You need to be careful if it is always the same spot that is itchy and it doesn't move around to different areas. And fifth is the family history check. If your parents or your siblings have had cancer, you have a 2 to 3 times higher chance of developing it yourself. You need to be especially careful if it is the same type of cancer that runs in your family. Don't miss the small signs. If you have a family history, it is wise to get frequent checkups. Just confirm these steps one by one. Thank you for listening to this long story. Now, let's quickly go over everything one more time. First, confirm the 6 dangerous spots for itchiness. If your lower legs are itchy, you need to check for lymphoma, especially if it worsens at night and creams don't seem to help. If a spot in the middle of your back is itchy, it may be an early sign of pancreatic cancer. If this comes along with poor digestion, you need to get a checkup. If your scalp or the back of your ears are itchy, it may be a sign of leukemia. If changing your shampoo doesn't work and it gets worse at night, you need to get a blood test. If your chest area feels itchy, it may be inflammatory breast cancer or male breast cancer, and this is true for men as well. If your anus or reproductive organs constantly itch, you need to be checked for anal or vulvar cancer. Please don't feel embarrassed and delay a checkup. Go see a doctor soon. If only the palms of your hands and the soles of your feet are itchy, it could be a sign of internal cancers. If this comes along with other symptoms, you need to be careful. And then, repeat the self-diagnosis steps. Remember the 3-week test. The itchiness is more than just a simple issue if it lasts for more than 3 weeks. Did you try the cream test? You should suspect internal issues if the cream does not work after a week. Also, make sure to check for side symptoms. Fatigue, fever, and loss of appetite are highly related to systemic diseases. The pattern is also important. It may be a cancerous itch if it worsens at night and if it stays in the same spot. And finally, run through your family history. Don't miss the small signs if you have a family history of cancer. Get checkups often. Not all itchiness is a sign of cancer, but it is true that many cancers start with small, subtle signs. Please don't just shrug things off because of your age. Listen to the signals your body is sending you. I am still seeing patients at my age because I know that paying attention to these small signals can save lives. In all my years of seeing patients, the biggest lesson I have learned is that most cancers can be successfully treated with early discovery. Here's something I'd like you to do. Check your body tonight before you go to bed. Think about where it's itchy, when it's at its worst, and how long it has been going on. Mark it on your calendar and record the timeline properly. If any of the symptoms that I've mentioned today match yours, please don't feel embarrassed. Go see your doctor, and be sure to accurately describe when the symptoms started, the pattern of the itch, and any other symptoms you're having. Your health is the most important thing you have. Money and fame are not nearly as important as your health. Let's make this conversation the first step toward keeping your life safe. In a future video, I hope to talk with you about the warning signals behind some of the most common symptoms we associate with aging. There are many things to be careful about with symptoms like joint pain, poor digestion, and headaches. If you would like to share the valuable information that I've mentioned today, please pass this video along to your loved ones. I hope everyone stays healthy. If you start now, think about what kind of life you will be living next year. It can be a more healthy and energetic life.